हॅलो दोतोर, हे कार्यावळीचो उत्तरार्ध म्हणजे सेकंड हाफ आणि आमच्या बरोबर आसा डॉक्टर कॉनी डिसिल्वा, बाळंटेरशास्त्र आणि बायलां रोग तज्ञ विभागाचे डॉक्टर. तुमच्यांनी बायलांच्या दुयेंसां विशीं किंवा प्रेग्नन्सी विशीं जे दुयेंस प्रश्न आसा ते तुमच्यांनी मुजत विचारूं येतात आणि आमचो नंबर जावन आसा 24904444 आणि 24904445. परतून एकदां सांगता, प्रश्न विचारतना घरा कडल्या टीव्हीचो आवाज मातसो कमी करात. आणि इवन तुमकां आनी एक गोश्ट सांगता की इवन पाळी सारकी येना, पिरियड सारको येना, फाटी फुडें जाता किंवा खूब दीस उरता किंवा बेगीन बंद जाता, लेट बंद जाता, हाचे सारके सुद्दां जे तुमचे प्रश्न आसा ते तुमच्यांनी विचारता. कारण तुमी फायनली फोनार उलयतना कोणाक तशें काय व्हडलेशें कळचें ना. पण एक यू कॅन टेक दीस ऑपॉर्च्युनिटी टू गेट ओपिनियन फ्रॉम डॉक्टर कॉनी. डॉक्टर, आमी उलयताले डायबिटीस विशीं इन प्रेग्नन्सी. सो तुमी सांगिल्ले ते स्प्लीट मील घेवप खूब गरजेचें. जेन्ना डायबिटीस प्रेग्नन्सीच्या वेळार येवं शकता किंवा आयिल्ली आसता तेन्ना पेशंटान स्प्लीट मील घेवप खूब गरजेचें. म्हणजे एक 2-3 वरांचो अंतर घेवन सकाळी समजा 8 ब्रेकफास्ट घेतलो जाल्यार 10-10:30 म्हणसर ताणें कितें तरी खावप, परत 12 म्हणसर खावप, परत 4-4:30 म्हणसर खावप आणि रातचे 7:30-8 म्हणसर आपलें डिनर घेवप खूब गरजेचें. म्हणजे एक जे तुमचो आहार आसा तो स्प्लीट करून घेवप, एकाच वेळार चड खावप ना. ही अतिशय म्हत्वाची गजाल, स्पेशली डायबिटीस मॅनेजमेंटा खातीर. अदरवायज सुद्धा डॉक्टर जे असतात, एंडोक्रायनॉलॉजिस्ट, ते हेच रिकमेंड करतात, पण प्रेग्नन्सीन हे आनी खूब गरजेचें आसा. डॉक्टर, एनी अदर स्पेशल केअर यू एडवायस during pregnancy to your patient for a healthy outcome?
They also have to keep a track of the movements of the baby. Very important all through pregnancy. Then as I have told, sir, follow-up during pregnancy is very important. And any problems, even if they have minor problems, they should be reported to the doctors. Another thing is to build up your hemoglobin. Our women are very poor about their hemoglobin actually. And they have to build it up to their diet by eating a lot of iron-rich food like methi, spinach, palak, all those type of vegetables, maybe a beetroot or something. And because hemoglobin itself, it supplies for two. This thing, mother supplies for two, so she has to make up for a hemoglobin. Adequate rest is also important. No stress. Rest as in she has to at least minimum take a rest of 2 hours in the afternoon. That is what is advised. And a good 8 hours sleep in the night. And not in the early pregnancy, but later part of pregnancy, they should sleep on the left hand side. It enhances the growth of the baby, helps in increasing the growth of the baby. It's always good. No stress. Cigarette smoking should be avoided in women who actually smoke cigarettes. Alcohol should be avoided.
आणि एक पॉझिटिव्ह थिंकिंग. सो डॉक्टर, हो प्रश्न आशिल्लो की बरे बेबी जन्माक येवपा खातीर आवयची कशा पद्दतीन आमी तिणी खंयचो एडवायस फॉलो करपाचो, स्पेशली ड्युरींग प्रेग्नन्सी. कारण खुबशे फावटी हे ज्यो गजाली आसतात त्यो दोतोरा कडेन तितको उलोवपाक टायम आसना, ते आपले तितकेच पुरते सांगतात. पण डॉक्टरान सांगलें एक खूब म्हत्वाची गजाल आसा की हिमोग्लोबीन बिल्डअप करप खूब गरजेचें. त्या खातीर वेगळे तरेचे तांणी सांगलें, म्हणजे बीटरूट, मेथी, स्पिनाक हे सगळें खावप, फळां आहारान दवरप, जसो सांगला तसो आहार व्यवस्थीत घेवप, रेस्ट महत्वाचें आसा. जेवल्या उपरांत कमीच ते 1-2 वरां दनपारचें न्हिदप आनी रातची 8 वरां कंपल्सरी रेस्ट घेवपाकूच जाय. स्ट्रेस घेवप ना, चड प्रत्येक गजालीचो ताण घेवप की मातशें एक आतां कितें जातलें, हें कितें जातलें, अशा पद्दतीन वरी करनासतना वॉट एवर हॅपन्स, लेट्स बी पॉझिटिव्ह आनी बऱ्या पद्दतीन एक हसमूख चेहऱ्यान हें नवें चॅलेंज किंवा नवें आव्हान तुमी स्विकारप खूब गरजेचें आसता. त्याच प्रमाणे भुरगें कितलें भोंवता, कशें भोंवता हाचेर एक लक्ष दवरप. आणि डॉक्टर, what type of exercise do you recommend? Because suppose if suppose a person is generally going for evening walk or morning walk, in pregnancy, what are your recommendations?
I still would like to advise them continue walking around half an hour maybe or 45 minutes, as much as they can tolerate.
अच्छा, म्हणजे जेन्ना तुमकां शक्य आसा तेन्ना आनी जितके तुमी तोलू शकता तितको म्हणजे चलप हें खूब गरजेचें आसा. हातूंतल्यान तुमकां एक नैसर्गीक वातावरणाची तुमचे कडेन एक्सपोजर जातलें, बरें दिसतलें, प्रसन्न मनूय उरतलें आनी शरिरा खातीर योग्य तो एक्सरसायज जातलो आनी तातूंत स्ट्रेनिंग जावचें, म्हणजे स्ट्रेस जावचो ना. बट इट शूड बी विथीन लिमीट. चडूय खूब एकदम म्हणजे धांवत पळत वचपाची गरज ना. आनी दीस इज व्हेरी गूड. जशें डॉक्टरान सांगलें की हातूंतल्यान तुमचें मन प्रसन्न उरतलें, शरीर फीट उरतलें आनी यू विल बी प्रिपेर्ड फॉर द बेटर आउटकम. डॉक्टर, अपार्ट फ्रॉम दीस, what I'm like to ask you is that often female get lot of these menstrual irregularities and they are quite म्हणजे खुबशे फावटी ती बायलां डॉक्टरा कडेन वचना, तांकां आसता दोतोराक वचपाक सांगपाक लज, किंवा स्पेशली एट यंग गर्ल्स, म्हणजे आयदर दे गेट म्हणजे तांकां फ्रिक्वन्सी फास्ट आसता किंवा थोड्यांचे पिरियड खूब डिले जाल्ले आसता किंवा थोड्यांक 5 दीस 8 दीस अशे आंगार जातात आनी ते आंगारच तोलतात. वॉट आर द डिफरंट कॉजीस ऑफ ऑल दीस टायप ऑफ इरेग्युलरिटी, हाऊ दे कॅन बी मॅनेज? एक इलॅबोरेट आन्सर अशें म्हणून.
So in the first few years of when you attain menarche,
Yeah.
the first between 13 to 18, I think sometimes cycles can be irregular.
Yeah.
In some girls, it
Yeah.
will naturally become regular after 18 years. So those girls need not worry actually. Suppose if they have heavy periods, those teenagers, then we have to look into other causes like platelet disorders or something. So investigations have to be done, hemoglobin, etc. have to be done. Thyroid abnormalities are also very, very common in
Yeah,
women.
these are the days, in
Around
fact-
50% women, at least I think more than that maybe, have some amount of thyroid abnormalities. Generally it is hypothyroidism. So that is one of the major culprit in this bleeding
Irregularities.
irregular bleeding. PCOD, as we spoke about before, that is another cause.
Yeah.
And according to this, maybe the thyroid level has to be done. Scan needs to be done to look into any, even cyst can cause, even ovarian cyst can cause. So a scan would be better to do, better look at for polycystic ovarian disease as well as for any cyst, etc.
अच्छा डॉक्टर अनेक क्वेश्चन जाता की खुबशे फावटी आमी पळयता की फायब्रॉइड किंवा म्हणजे गर्भपिशवीन गाठ जावप quite these are I'm not saying it's quite frequent now in fact earlier past days also only that now we are detecting at earlier कारण की असा अल्ट्रासाउंड सगळीकडे अवेलेबल आसा पेशंट डॉक्टराकडे वतात आणि आपली तक्रार सांगतात म्हणून आमकां बेगीन अर्ली डिटेक्शन जाता पण हे ज्यो फायब्रॉइडच्यो गाठी आसत म्हणजे त्यो एक तर पिशवेन भितरल्यान जाता किंवा पिशवेच्या आंगान जाता किंवा पिशवेच्या भायल्यान जाता तर हाचे विशीं मातशें आमकां थोडें समजावन सांगात
Fibroid is one of the most common, खूब common asta one गांठ जावप it's very, very common in women.
Yeah.
Now, whether it causes symptoms in them, how bad it is, all those things need to be looked into. So first we have to do an ultrasound. Also looking at the history, whether the woman is having heavy periods, whether she's having any pain during her periods, pain while passing urine, recurrent urinary infections, all these things need to be looked into, evaluated.
Yeah.
Scan would tell the size of the fibroid. If it is a small fibroid, if there are small seedling fibroids, we can ignore it and then keep assessing it and later see if it is growing in size. If it is a huge fibroid and she is symptomatic, then probably we need to act upon it, need to operate or need to start give her some medicines or something generally. It can also affect fibroids, especially the submucous fibroids can affect fertility. So it needs removal before conceiving. Sometimes women might have difficulty in conceiving because of a submucous fibroid. Other fibroids, they are controversial. We do not, as far as infertility is concerned, and we do not know whether it will actually impair infertility. But as far as submucous fibroid is concerned, they say you must remove it before
so that she can conceive. म्हणजे खुबशे फावटी हे ज्यो गाठी असतात ते जर पिशवेन भितरल्यान आसा जाल्यार आनी जर ती प्रेग्नन्सी ते बायलेक घेवपाक त्रास जाता जर ती प्रेग्नंट जायना किंवा गुरवार जायना जाल्यार ती काडून घेवप खुबशे फावटी हेल्पफूल जावंक शकता आनी पेशंट अशे जे पेशंट आसा ताका मागीर हेल्प जाता आनी शी कॅन कन्सीव म्हणजे बेगीन कन्सीव जावंक शकता बेगीन प्रेग्नंट जावंक शकता बाकीच्यो ज्यो गाठी आसा त्यो पेशंटाची हिस्ट्री जशी आसता म्हणजे समजा तिका ब्लिडींग चड जाता खूब दुखता ह्या सगळ्या बाकीच्या गजालींचेर डिपेंडंट आसता त्याच प्रमाणे त्याची सायज कितें आसा एक अल्ट्रासाउंड करून आमी जेन्ना डिटेक्ट करता डायग्नोज करता तेन्ना ते कन्फर्म केल्या उपरांत ताचेर वेगवेगळ्या पद्दतीन भाश्य करूं शकता किंवा ती काडप की नाही थारावंक शकता डॉक्टर आय वूड लायक टू आस्क यू वन मोर थिंग these are the days we are going for this laparoscopic surgeries. What is the advantage of this laparoscopic surgery as far as fibroids is concerned? Because we are considering a younger age group. See, most of the people, most of the young ladies are into having this problem.
Laparoscopy, as far as in case of infertility, laparoscopic myomectomy always would be a better option. Correct. If an expert surgeon is available. In case of infertility patients. Other patients, if they are going in for hysterectomy and if the size of the fibroid or the size of the uterus is adequate enough, like within the 14 weeks or something, it is not very big, then we can actually go in for laparoscopic surgery. But laparoscopy helps more, and removal of laparoscopic myomectomy would be the best, would be a better option. Laparoscopy is most useful in myomectomy. Also in hysterectomy it can be done.
हे जे गाठी आमी उलयताले फायब्रॉइड्स तेंचे चडशे फावटी डॉक्टर म्हणटा की लॅप्रोस्कोपिक रिमूवल म्हणजे दुर्बिणींतल्यान शस्त्रक्रिया करून काडप खूब गरजेचें आनी अशें केल्ले तांकां फायदोय चड जाता तांकां त्रासूय चड जायना आनी अशें करप खुबशे फावटी इज द मेथड ऑफ चॉयस फॉर स्पेशली जेन्ना इनफर्टिलिटी पेशंट आसता तांकां आनी खंयचे व्हडले स्कारिंग करनासतना व्हडले चिरण नासतना अशा पद्दतीन जर ते फायब्रॉइड काडले जाल्यार तांकां प्रेग्नन्सी येवपाकूय खूब फायदो जावंक शकता हॅलो
हॅलो
हां
गुड इवनिंग डॉक्टर
गुड इवनिंग
हांव आना उलयतां
हां उलय
डॉक्टर हे आमचे भुरगे जल्मले आनी 6 म्हयन्यापासून 1 वर्सापासून उलयलो मातसो पूण मागीर आमी ताका डॉक्टरागेर व्हेलो डॉक्टर कितें म्हणूं लागलो मायल्ड ऑटिझम आहा तर कशें कितें तें पयलो भुरगो बरो जाला तो व्हडलो आहा 9 वर्सांनी हो जाल्लो ताजें कशें आतां कितें डॉक्टर उलयता मातसो तो आन्सर सगळें दिता पूण हें करिना म्हणजे उलयता आपणाक जाय पळय तें पूण आन्सर दिना डॉक्टर तो
एकच प्रश्न विचारता ही जेन्ना डिलिव्हरी जाल्या तेन्ना आवयचें वय कितलें आशिल्लें पिराय कितली आशिल्ली
आवयची पिराय हाली 36
Also, we need to look whether it's case of CP, mild CP, early CP, cerebral palsy. Also, so
yeah, you can answer this question. It is for you.
No,
तिका कितें जालें डॉक्टर प्रेग्नंट हाडली पळय तेन्ना मातशें हें मेळ्ळें तिका डायबिटीज मेळ्ळी मातशी आनी हें हायपरटेन्शन
डिलिव्हरी नॉर्मल आशिल्ली काय सिझेरियन डिलिव्हरी नॉर्मल आशिल्ली काय सिझेरियन केल्लें
ना नॉर्मल दोन्ही डिलिव्हरी नॉर्मल
अच्छा
sometimes actually whether there's delayed milestones we need to know. Milestones are normal. If milestones is the milestones normal? We have the caller online. No, she lost.
No.
She's gone. If the milestones are delayed, then we have to actually look into an angle of cerebral palsy also, whether baby is suffering from mild cerebral palsy. That is important. We need to know the birth history, whether there was delayed difficulty in birth, whether it was a big size baby, all those things. And
possibility is there because unfortunately during this pregnancy this patient was having hypertension as well as diabetes. And third parameter according to me is that her age was 36 years. So all this म्हणजे unfortunately म्हणजे कितें आशिल्लें न्हय ह्यो प्रेग्नन्सीच्या वेळार म्हणजे बायलेचें वय सुबेज आसप त्याच प्रमाणे प्रेशराचें दुयेंस म्हणजे हायपरटेन्शन आनी डायबिटीस ऑफ इज ऑल दीस म्हणजे हे नाका आशिल्ले सगळे ताचे ग्रह जुळून आयले अशें म्हणून येता आनी परहॅप्स दॅट मायट हॅव
could be a reason.
पण सगळ्याच पेशंटांक अशें जाता अशें ना बट अदरवायज ऑल्सो यू हॅव टू बी म्हणजे लिटल कॉशियस एज फार एज म्हणजे पेशंट आमी वॉट इज युअर रिकमेंडेशन फॉर प्रेग्नन्सी एज वायज
The most healthiest oocytes are when the patient is very young, probably in their 20s. That is the best favorable time to have pregnancy. But it does
unfortunately कितें आसा गोंयांत these are the days people are more interested in making career आनी मातसो अभ्यास आसता कोणी स्टडी आसता जॉब आसता आनी प्रेग्नन्सी डिले जाता थोड्यांचे घर जावपाचें आसता थोड्यांचे वेगवेगळे कारण आसा वी आर नॉट सेईंग दॅट इट शूड नॉट बी पण हातूंतल्यान जेन्ना प्रेग्नन्सी डिले जाता तेन्ना खुबशे फावटी ते भुरगे अफेक्ट जावपाचे चान्सीस आसतात सो म्हणजे यू शूड ऑलवेज कीप दीस एट द कॉर्नर ऑफ युअर मायंड एटलिस्ट की अशी शक्यता आसा सो यू शूड नॉट अननेसेसरी डिले इट बाबा सामकें जेन्युइन कारण आसा आनी हें आसा जाल्यार इट इज फायन बट अर्लियर द प्रेग्नन्सी इन द म्हणजे जशें डॉक्टरान सांगलें की 20च्या खातीर 20 to 30 years एज ग्रुप इज द आयडियल एज ग्रुप फॉर दीस Okay, doctor. We were talking something about fibroid.
Fibroids.
Yeah. So no, we were talking about the periods. I think that is also. Yeah. So what I was asking, this removal of fibroid, you said like especially in infertility is helpful because if you do laparoscopic surgery. What are the other options for this patient, like opening?
Yeah, open method also can be done if it is a big fibroid and all. Open myomectomy is
okay.
Also
What
done.
is your size which you recommend ki above this size generally? I'm not talking because every surgeon says that okay,
yes,
we can.
Depends.
But yeah.
I would rather go in for a laparoscopic myomectomy if the size is less than around maybe 6 centimeters. If it is more than that, better to do an open this thing. Okay. It also depends on your expertise, how expert you are, and there are surgeons outside who do with bigger fibroids as well. Okay. So it's difficult to have a size, but it's finally about the outcome. As long as the patient is like able to conceive, I think that we are happy, whichever method you do.
Whichever method you do. Okay, Doctor, I want to ask you one more thing. Are these fibroids more common these days? Maybe because of our lifestyle.
I think I'm
just asking you.